morning, everyone. Thanks for joining us on this COVID-19 vaccine Q&A panel. My name is Ryan Zimmerman. For those of you who don't know, I'm the Corporate Communications Manager for Laurel Health Care Company. Most of you will recognize our experts on the panel today, either their faces or their voices, but I'm going to give them a minute to introduce themselves before we get started. The questions we're going to be answering today, they are the most commonly asked questions that have been submitted to our Ask About COVID-19 email that were submitted into the Relias survey from that mandatory COVID-19 educational PowerPoint, and also just general questions from the field. Most of the most common questions that we hear trickle up from our facility administrators, our DONs, our regional team. It's a combination of all of these most common questions that we're hearing related to the COVID-19 vaccine. So like I said, I'll let our experts introduce themselves real fast before we get started, and we'll start with Kathy.
Good morning, everyone. I am Kathy Chavarro. I am the Vice President of Operations at Laurel Health Care Company, and I have been with the company almost 16 years, and it's nice to be here.
Krista.
Good morning. I am Trista Piccarelli. I'm the Director of Clinical Services for Laurel Health Care. I was on the Sienna side of the organization for the last 10.5 years, and I'm happy to have passed my 1-year mark on the Laurel side of the organization. And I look forward to hopefully answering any questions you may have about the vaccination.
Next up, we have Jane.
I'm Jane Bailey. I'm the Director of Clinical Reimbursement. I've been with Laurel over 18 years, so it has been a great time, and I'm happy to be here.
And finally, we have Chris with us also.
So I'm Chris Rogers. I'm the Director of Clinical and Education Programs for the company. I have been with Laurel's for 13 years, and I have been a nurse for 33. So I want to thank you for taking the time to join us, and this is your time to get more information about the vaccine so that you can make an informed decision.
So we are recording this webinar, and between either this webinar or our 7 p.m. call, I guess whichever goes better, we'll try to upload one of them to the Laurel Net, assuming we can find out the technological things behind it that require being uploaded. So but with that, we'll get started and dive right into our questions. Our first question is the vaccine being mandated? And we'll start with Kathy for answering that question.
This is a really common question that we've been hearing, and I just want to take a minute to explain that the vaccine was authorized under an EUA, which stands for an emergency use authorization. So because of that, it can't be mandated by the federal government. However, the EUA does not prohibit an employer or the state or local health department to decide that they want to mandate it. At this time, no one has decided that. And so therefore, at this time, we've decided that we will not be mandating. We will follow the guidance that's given to us by our regulatory agencies, but we're hoping that through education and forums like this to answer questions that we actually wouldn't have to come to mandating, because we're hoping that people will want to be vaccinated.
And Kathy, as we know right now, there's both a COVID-19 vaccine from Moderna and one from Pfizer. Which vaccine will Laurel facilities be receiving?
So it really depends on what state. The Moderna vaccine has been made available for our facilities in Indiana, Michigan, and North Carolina. And our Pfizer, the Pfizer vaccine has been offered to our facilities in Ohio and Virginia. Things could change. It depends on the accessibility of the vaccine, but that's what we've seen so far. And it is important to understand when you're getting the vaccine, which vaccine you're getting, because they have different periods of time in which you need to wait to get the second dose. Overall, the efficacy, which is how effective the vaccine is very similar. Pfizer has reported that their efficacy is 95% overall, and Moderna is 94.1%. So very, very similar performance from the vaccines. But again, the key thing is making sure that if you get dose 1 of Pfizer, you follow it up with dose 2 in the right timing, or Moderna.
One of the most common questions we've heard from the field is, if I've already had COVID-19, why would I need to take the vaccine? Trista, can you clarify that for us, please?
Sure, Ryan. So with COVID-19, there's some really serious health risks that are associated with the virus, and our experts on COVID-19, and by experts, I'm talking about CDC and Dr. Fauci and all of those, they really don't know how long somebody has that COVID-19 protection from getting sick again once you've already had it. There's a couple really serious side effects that can there's some really serious consequences that can happen when you have the COVID virus, including things such as demand ischemia, which is when your heart, the demand for oxygen is too much for your heart, and it causes areas of ischemia, which is a damaged area to the heart muscle. There's also things such as acute respiratory distress syndrome, which can cause permanent scarring to your lungs. These are some serious health risks associated when you get the virus. So you may or may not have experienced that if you've gotten the virus once. There's also things that they call long haulers, and those are COVID-19 patients that have recovered and continue to experience long-term side effects, such as like body aches, joint pain, shortness of breath, difficulty with sleeping, loss of taste and smell, even if you didn't have that when you had the initial virus. And then brain fog is one of those largest areas of the long haulers. So when you have COVID-19, your body does develop some immunity from having the infection, and that's called natural immunity. But that natural immunity varies from person to person. And early evidence is suggesting that the natural immunity with COVID-19 may not last very long. So by taking the vaccine and having already had the COVID-19 virus, not only are you giving your body that natural immunity from having the virus, but you're getting a vaccine-induced immunity that's going to help you fight that virus off again.
So I want to briefly mention, because I saw a question pop up in our Q&A panel, if you're on your computer or using the Zoom app on your phone, there's a Q&A option, so you can submit questions as they come about as we're going through this panel. This specific question that was asked, we're going to address, I think, in one of our questions here shortly. The rest of the questions we will try to address if we have time available at the end of the presentation. So Tristan, another thing we hear very commonly from the field, if you are someone who currently has COVID-19, how soon after recovery can you receive the vaccine safely?
So that's been that's a great question, Ryan, because that's been something that we've heard varying reports on. So we don't know how long someone's protected from getting sick again once they've had COVID-19. But what we do know is that once you have COVID-19 and you've recovered from it and you are no longer on transmission-based precautions, you are eligible to get the vaccine. What we do know is that somebody that has been infected with COVID-19 may or may not have some type of immunity for 90 days. So we encourage you to get the vaccine as soon as you're recovered from COVID-19 and you're off of transmission-based precautions.
A very common misconception you hear on social media is that the COVID-19 vaccine involves having a live virus injected into your bloodstream. Jane, can you clear up that misconception and explain what the COVID-19 vaccine entails?
So the COVID vaccine does not include an inactivated or live virus at all. It has messenger RNA in it. So there is nothing in it that can give you COVID. Now, some people, especially after the second dose, have experienced COVID type illnesses, which according to the scientists is related to your body creating the antibodies. So it's your own immune response and is a good thing. So it's not just the CDC that has said that. We were on a webinar with the Ohio Department of Health that had a variety of experts, and they confirmed that that is what you are experiencing. So can it give you COVID, it cannot because it's not a virus, but you may experience some symptoms from your body building its own immunity. So I think that should answer the question.
Great, thanks, Jane. So there's been some concern about how quickly the vaccine was produced. Since it was produced so quickly, can it be considered to be safe? Jane, we want to answer that as well.
And I think this is a great question because it's one I had very early on as well, until I started doing some research. I was lucky enough to, if you were on the first call, you got to hear about my chemistry saga, and I will not make you listen to that again, but it helped me really understand how a lot of this works. So the work with messenger RNA on vaccines is not new. It has been going on for over 30 years. And so scientists a long time ago recognized that using messenger RNA to assist the body in making antibodies with COVID, it's that little spike protein that you've probably heard in the news, so that your body will respond to, will make antibodies. And that's how it keeps you from getting it. So if COVID comes knocking on your door, you already have antibodies that fights it off so that you don't get sick. So scientists knew a long time ago that messenger RNA was going to be good for this. They just, they've been working on it for 30 years to work out all the kinks. In 2003 is when they discovered, when we first started seeing the SARS virus, which is the family from which COVID-19 comes from. And so they knew that this particular virus would respond, would work well with messenger RNA. But there never was a pandemic type virus yet in that family until the year 2019, when we started hearing about COVID-19 in China, and then it quickly spread around the world. So scientists were probably cheering behind closed doors whenever this happened, because they could finally get the money. All scientists from around the world were able to band together. They could get the resources money-wise to continue the research and get this going. So they were all ready to go the minute they started hearing stories. So it was quick in the part that we saw, that we heard on the news, but it was not quick in terms of all the years spent working on this type of vaccine and studying the SARS virus family. So years of study went into it. So it really wasn't brand new.
And Jane, as far as like the clinical trial and development, there were no steps skipped. It was just at an accelerated pace, correct?
Correct. There were absolutely no steps skipped. It's just they had so much of the work already done that they just had to verify a lot of that and move forward. So all the steps are there. It's just that they had years to plan before the perfect virus rolled along. So,
and if you think about it, this has been the sole focus of the very best scientists in the world for a year, this specific vaccine with unlimited resources, a much larger clinical trial than most clinical trials. So yes, that's another reason why this has been able to be developed so quickly.
And I think it's important to note as well that because it's been a pandemic across the world, not just our country, but in our country being a pandemic, the scientists have received additional funding to help move this vaccine along, which in a lot of vaccine trials and different drug and vaccine trials, the funding sometimes becomes an issue. So with all of the additional funding from our government, it's helped move this vaccination along.
So during the trial specifically, which included 30,000 to 50,000 participants between the Moderna and Pfizer vaccines, when most of these clinical trials that you hear of only have about 3,000 participants. So there's a much larger pool that has been worked with. During these trials, was the group of participants diverse enough to ensure the vaccine was safe for all ethnic groups? Jane, could you possibly answer that question?
Yes, the first two phases, I think that this misconception comes from the first two phases where they started out slow with not near as many participants, and about 10% were minorities. By the time they started the phase 3 trials in July, globally, 42% of the participants were minorities, and in the United States, 30% of the population was minorities, so, or different ethnic groups. So I think that that well represents the typical thing, the typical population, so that we can feel comfortable that ethnic groups were well represented in the trial. Yes.
One of the things we hear a lot from the field is concern about side effects, not only side effects, but severe side effects. Chris, can you talk a little bit about what side effects can be expected and just what we've kind of heard from our clinic so far on Laurel's?
So all vaccines have the potential for side effects, and you have to weigh the risks and the benefits of those side effects versus the vaccine. The biggest concern that we hear because of what's out in the media is the severe allergic reaction, which is the difficulty breathing, the swelling of the face and the throat, racing heartbeat, full body rash that leads to anaphylaxis. This reaction is extremely rare. We're not seeing that at all. If this reaction is to occur, it's usually going to occur within the first few minutes of receiving the vaccine. And that is why whoever gets the vaccine, we require you to stay in the facility for at least 15 minutes for some immediate monitoring. And we do have the EpiPen available if that would happen. But again, that is extremely rare. What is more common is the actual side effects that's being reported is the injection site pain, feeling tired, having a headache, muscle pain, chills, joint pain, fever, the injection site swelling, redness, maybe some nausea or just some general not feeling well, and some potential swollen lymph nodes. But when you're getting that type of reaction, as Jane said earlier, that is your body actually creating some of that immunity by stimulating the response system and making those antibiotics. Now, as far as the side effects, how long or the severity, we are not seeing that. And the question is in the media that the second dose, the side effects could be more pronounced than what they were in the first one. Again, we are not seeing that in all of the vaccines that we're doing. And it's just not what we're seeing. It's just not.
And again, you emphasis on pronounced, not different symptoms, just your general symptoms of fatigue, fever, headache. You might have slightly more pronounced, potentially from overall studies that in the second dose there might be more pronounced symptoms, but so far in our clinics, we're not seeing that.
Correct.
And we've had a handful of second clinics occur already, Ryan.
Yeah.
So we have, some of that data. We've had a handful occur, I believe this week. We had a couple of our second clinics and we've not yet been seeing that increase in symptoms.
And the side effects, they can occur up to 6 weeks after the vaccination. But again, think about the study, they're still studying that. So it is important if you do have any type of reaction after you receive the vaccine that you are reporting it appropriately.
And then just kind of, I wanted to briefly touch on severe side effects again and how exceedingly rare they are. If any of you read an article I sent out in a company alert last week, I believe the CDC said out of 2 million vaccines that have been administered, there had only been 21 what they would classify as any type of severe allergic reaction. So that just shows you how exceedingly rare these reactions are. So Chris, if someone has had reactions to other vaccines in the past, is it safe for them to get the COVID-19 vaccine right now?
So CDC does not recommend the vaccine if you have previously had a reaction to any other vaccine or to any of the ingredients in the vaccine itself. It is, if some people have had reactions to different non-allergic reactions, such as like you're allergic to strawberries or dust, or latex, you can get vaccinated. That is recommended under CDC. But if you have ever had any type of reaction to any type of vaccine or any of the ingredients, it is not recommended that you get the vaccine. Or if you have any reactions, if you've got the first one, you should not take the second one. If you have any concerns about your allergies, you do need to talk to your healthcare provider and discuss that with him or her before you consider taking the vaccine.
And you mentioned the ingredients of the vaccine. Trista, could you briefly touch on what those ingredients are?
Sure. So Jane had spoken earlier about the messenger RNA. So that truly is the only ingredient that's considered an active ingredient in the vaccine. And in our previous meeting that we had about the vaccine, Jane explained with her chemical courses that she took and how that works. And I'll try to be as graceful as Jane was in her explanation, but the messenger RNA molecule is really the only active ingredient in the vaccine. And that mRNA or messenger RNA is what contains the genetic material that provides the instructions to our body on how to trigger a protein that will trigger the immune response within our bodies. It does not alter our DNA at all. That messenger RNA actually is covered by a lipid, which is like a greasy material, to help it slide into the cytoplasm of our cells. Remember, the DNA is made in the nucleus. So this is only going into the cytoplasm of the cell. So it does not alter your DNA at all. That's the only active ingredient that's in either one of the vaccines, the Moderna or the Pfizer. And then there's a couple inactive ingredients in both as well. The lipids, like I just explained, to help grease that messenger RNA molecule so that it can slide into the cytoplasm of the cell. They also both contain salts, sugar, like your basic table sugar. So the salts help, they're the type of salts that you would find in like food preservatives. The sugars help to maintain the shape of that messenger RNA when it slides in. And then there's acetic acid that you would find in vinegar. So it's acids in the Moderna. And that's really about it. You know, you have your lipids, your salts, your sugars, and your acids. And then again, the messenger RNA is the only active ingredient. It's like any other vaccine. You're going to have some inactive ingredients to maintain the integrity of the vaccine.
Chris, we'll come back to you for this next question. You may have touched on this briefly in your previous response, but how or when will we know more about the long-term side effects of the vaccine?
So studies are still being gathered. As Trista and Jane both alluded to, we don't know the long-term side effects of the vaccine, but we do know the long-term side effects of COVID itself. So the COVID lingering side effects are coughing, body aches, joint pain, loss of taste, loss of smell, difficulty sleeping, and then the headaches and the brain fog. And the brain fog is reported as unusual forgetfulness, confusion, and unable to concentrate. And unfortunately, that is happening to 10% of the people that recover from COVID will potentially experience this type of long-term effect. They're still gathering the data on the long-term side effects. And the data that they had in the studies, there really is none that's being published.
Yeah, I believe the CDC says that most side effects are occurring within 6 weeks of vaccination.
Ryan, can we just,
Go ahead, Trista.
let me backtrack just to the ingredients real quick. I did want to make mention with the ingredients for the vaccinations that they do contain polyethylene glycol. It's a substance that's found in osmolytic laxatives. So some of your over-the-counter laxatives and some of your bowel preps. So if you have an allergy to that or a known allergy to polysorbate, those are two inactive ingredients, but they are in the vaccine. And if you have a known allergy to either of those, you should not take the vaccine.
Thanks for clarifying that, Trista. One of the questions we got from our Relias survey, an individual has a history of Guillain-Barre syndrome. Should they take the vaccine? Jane, could you answer that?
Sorry, my phone rang. And okay, so there is nothing to indicate that someone with Guillain-Barre cannot take the vaccine. However, I do urge you to talk to your physician about it before, if you have any type of major comorbidity such as that, before you take the vaccine. So they are saying, the experts are saying, CDC is saying that it is safe for Guillain-Barre, but I really encourage you to talk to your doctor before you accept it.
There's also been some news reports that the vaccine causes the Guillain-Barre, and the studies that have been done, it's been a handful of people, but the studies that have been done show that the actual population that has had the Guillain-Barre post-vaccine is what they would expect in the general population of that vaccinated client anyway. So there really is a correlation just of what the normal expectation would be with that population rate. Not necessarily, not saying that it's caused by the vaccine.
And then finally, our last allergy-related question before we move on to other topics. If someone has an allergy to latex, should they take the COVID-19 vaccine? Jane?
So latex is not part of either vaccine, and it is not used in the rubber stopper of the vaccine. So they will, if there's a change in that, the people giving the vaccine will let us know. But as of right now, there's no correlation to latex, and you're safe to get vaccinated. And that is according to the CDC.
So one of our
the Pfizer and Moderna websites as well.
Yeah.
We have it.
So one of the most common questions we hear from the field, will the use of masks still be necessary after being vaccinated? Trista, can you answer that question for us?
I can answer that question with a resounding yes. So getting the vaccination is going to help protect you against getting COVID-19, but you will still need to wear all appropriate PPE. So you will still need to continue to wear your mask and your face shield. And if you're in an isolation room, you'll still need to wear your gowns, your gloves, all of your required PPE. So getting the vaccination does not exclude you from wearing a mask or any other type of PPE that would normally be expected. Remember, the vaccine is one step in being protected from the virus. We need to make sure we're taking all steps in being protected.
Exactly. So you're still going to hear social distancing, in regular life
Absolutely.
for a long time until the majority of the population has been vaccinated.
Absolutely. Yeah. We're not going to say, you've had your vaccine and you don't have to wear a mask and everybody can congregate together. You still need to do the social distancing, your 6 feet. You still need to wear your mask. You still need to wear your face shield. You still need to wear all appropriate PPE as it relates to the patients that you're caring for, your coworkers, and even at home. You still need to make sure that you're taking those precautions outside of the work environment to protect yourself and your family from the COVID-19 virus.
Our next question, how long will immunity from the vaccine last? Chris, could you answer that for us?
Sure. Any vaccine is not 100% effective. But with this vaccine, if you get the second dose, your immunity is going to happen within that week. It's about 5 to 7 days after you take the first dose, you're going to have about a 50% immunity. After you complete the second dose, and both Moderna and Pfizer require a second dose, 5 to 7 days after that, that's when you're getting the efficacy that Kathy was talking about, to the 95%. Again, just reiterating that the vaccine protection is not immediate. We still have to wear our masks, social distance, practice good hand washing.
And we're learning more about how long the vaccine provides protection. I know Moderna CEO has come out and said that they expect that theirs will likely offer protection for a couple of years.
And the studies right now, we know that it's lasting at least 4 to 5 months. And again, we really don't know if this is a one and we're done, or if this is something that we're going to have to get every year. As the data is gathered and the research is done, we will know more as time passes.
Our next question, there's a common rumor floating around social media on the internet that this vaccine is going to contain a microchip. Jane, I know on our last call you talked quite extensively about that, but can you touch on that a little bit for us?
Sure. So the microchip rumor started with Bill Gates, who has taken quite a negative hit ever since the vaccine talk and COVID started, as being part of the conspiracy to track all of Americans. So that is the microchip. And I think it landed on Bill Gates after some research. Bill Gates, if you're not aware of the good things that Bill Gates does, he has a foundation with his wife, and they work with underdeveloped countries for and to help balance health inequities. And one of those ways they do that is through distributing vaccines of all kinds to especially children in these underdeveloped countries. So a problem that they ran into from when they would go over 1 year and then maybe go over 2 or 3 years later with more vaccines is determining who had actually been vaccinated. So one of the things that they did was they came up with like this little tattoo that when they gave a vaccine to a child, it left a mark so that they would know next time they went, this child has been vaccinated. Let's move on to a child that has not been vaccinated. And so that is the best I can unravel the microchip theory, because they want us to, some people on Facebook, especially social media, are concerned that Bill Gates wants to track our every movement. If Bill Gates wanted to, or anyone wanted to, we carry these little things called a cell phone that have location device services on them, whether or not you turn it on, and they can still find you. They know what advertisers know what you're searching for, what you buy. So they don't need a microchip to do that. The next thing is, if you're in your 40s or 50s, you have a marker on your left arm from a smallpox vaccination. And that's part of why that was done that way, so they would know who had been vaccinated and who had not. So, and also of note is smallpox is the only virus to be considered eradicated from the global world, not just a specific country or region. So just more proof that vaccines do work, can work. So I think that answers most questions about the microchip.
So essentially just Bill Gates doing a little bit of good for for the underdeveloped world spun off into he has malicious intent, and that's just not the case.
Exactly. And the Bill Gates Foundation, Bill and Melinda Gates Foundation, has been going since 2000 is when it started. So that's not new either. It's not something they whipped together in the last year just to track all of our movements. So they've been doing work for many years now.
And along the lines of microchipping, there's also confusion about the word nano. Jane or Kathy, could you kind of clarify what they mean about nano as far as vaccines?
I'll go ahead and take it. If you're familiar with the metric system, nano is a couple of notches below micro, so it means really, really small. So if it's nanotechnology, it's really, really small technology. If it's a nanosecond, it's a very small fraction of a second. If it's a nanogram, it's a very small fraction of a gram. So that's all nano means.
Yeah.
Again, it's not that you're being microchipped or nanochipped. It's just literally the measuring devices. Nano means very, very small.
Very, very small.
Yeah. So Kathy, can someone take the vaccine if it is against their religion?
That's a great question. So religion comes to a personal decision and personal preference. And really, whether or not someone takes a vaccine, again, falls to a personal opinion or personal preference. But what we have seen is that there are very few organized religions that are actually explicitly against vaccinations. So I think to make a decision about that, if you are still seeking information from the religious side of your decision making, you probably should speak with your minister, your priest, your spiritual counselor to work with something that can make you comfortable in your decision.
Our next question, what are some good resources for doing research about the vaccine? And I can tackle this question. CDC, FDA, those are probably the best websites to visit to get information about the vaccines. Moderna and Pfizer, their websites both have in-depth information about their specific vaccines, including an in-depth breakdown of the clinical trials that went through vaccine development. Your state and local health department websites are going to be great resources as well. Your physician is a great resource, and the facility medical director, the medical director at your facility is also someone you should speak with. Take advantage of the medical experts that are in your facility. We always say that you should be very skeptical of what you read on social media. Social media is full of conspiracy theories. It's full of misinformation. If you see something that you're questioning related to the COVID-19 vaccine on social media, do your due diligence and do your own research off of that. So go to legitimate websites, resources, and see if this is really something that you should be concerned about. As far as news outlets, kind of the gold standards as far as fact-based and non-opinionated and non-biased reporting are Reuters and the Associated Press. So if you're seeing articles from those two outlets, you can kind of have some confidence that they are reporting facts, they're not reporting opinions, and they're not reporting any bias, into one political spectrum or the other. There's a tool, if you Google it, it's a political news bias calculator. And it kind of will show you a graph of where different news organizations lean on as far as fact versus opinion and bias, left versus right, skewing opinions as far as news organizations. So you can find that pretty easily online. So just be aware of where you are getting your news from. And then our last question that we have before we get into your Q&A questions that you've submitted. And if you have any, as we're wrapping up, feel free to submit them to the Q&A. Have any individuals in leadership positions received the vaccine? I'll start. I received the vaccine about 2 weeks ago at one of our facilities in Columbus. And I have had no issues, no adverse side effects aside from a sore arm for about 12 hours the following day. The following morning after being vaccinated, I had a very, very brief bout of nausea for maybe 15 minutes in the early morning, and it passed. I don't even know if it was necessarily related to the vaccine. It could have been totally unrelated. So really the only pain that I experienced was just a sore arm, which I've experienced when I've gotten the flu vaccine. So we're 2 weeks in. I feel great, very happy about the decision I made, and looking forward to getting my second dose next week. Anyone else on this call that's been vaccinated that would like to share their experience?
I'll just say I've been vaccinated, very similar response to Ryan's. Sore arm, a little bit of a headache for about 24, maybe 36 hours. I've had a lot of headaches since COVID-19, so I'm not sure if it was related to the vaccine or not.
I received mine yesterday and no side effects whatsoever. As a matter of fact, I didn't even feel the needle when she put it in. So, I mean, I had a great experience so far.
I too was vaccinated yesterday, and I probably wouldn't have even had a sore arm, except last night I was like, wow, my arm's not even sore. So then I started poking around to see if I could find where the vaccine was given. And I did find a slightly sore spot that then continued to hurt for an hour. But I really think if I just left well enough alone, I probably wouldn't even have a sore arm. So, so yeah, so far it's been great.
So yeah, as you can see, I'll go ahead, Trista. Sorry.
I received the vaccine on Tuesday, and I just want to say, so I've been a nurse for 31 years, and when I originally had signed up to get the vaccination, I thought I was getting the Pfizer vaccine, and then I was exposed to COVID through my father, so I was on quarantine, and I missed my opportunity to get vaccinated. So I was off quarantine. I was able to get vaccinated yesterday, and it was with the Moderna vaccine. So I knew that I'd already researched the Pfizer. So I just want to piggyback on what Ryan said about doing your research. Being a nurse for 31 years, I still did my research, knowing I was not getting the Pfizer now and that I was getting the Moderna. So I did do some really intense research over the weekend about the Moderna vaccine, just so that I could feel comfortable as well, even being a healthcare professional. And so I did get the Moderna vaccine on Tuesday. I did feel the needle go in, but I feel the needle go in when I get my flu vaccine, and I feel a needle go in, if I have an IV started. I felt the needle go in. Now, when you talk about touching it, Jane, I can feel the area where it went in. As far as having a sore arm, I don't know. I worked out, so I'm a little tender, but it might be because I did a new exercise, and I'm not going to not do that exercise again because I have a sore muscle from it. So I really have not had anything. When I touch it though, it's a little bit tender. But I have to say, it's not like getting a tetanus shot, where your whole arm is aching and you want to chew it off. It's just a little bit of sight tenderness, that's all.
Yeah, and I had the same thing, Trista. I was able to exercise and lift weights later the next evening, even with a sore arm. And I think it actually kind of helped moving the arm around a little bit.
I honestly, I think so, Ryan, because I exercised, and so I guess I just don't know. I feel like it was from my exercise. So yeah.
So you guys can see a lot of our task force members have been vaccinated because we're very confident in this vaccine with the 95 to 94% efficacy. It's a slam dunk as far as vaccines go. We'll answer some of our Q&As that we've received. Given the fact that the centers have already established clinic dates, is there an opportunity to offer additional clinics, especially as staff become better informed of the benefits of the vaccine?
So I can start answering that, and anybody that wants to feel welcome to jump in. So we are encouraging staff to sign. If you're interested in getting the vaccine, we really want you to sign up when the clinic date is available. We have first, second, and third clinic dates, but remember the third clinic date, they will not be doing any initial dosing. So if you're interested in getting the vaccine, we highly encourage you to get it by the second vaccine clinic. Otherwise, we can't guarantee what the availability will be beyond that. We have 3 clinics that are scheduled through the pharmacy. But beyond that, we're not certain. So,
And I would just add, for Ohio facilities or staff in Ohio, you may have seen that the state has asked for us to indicate whether or not we would be willing to be a vaccine provider in the future, which we are enrolling in that. However, we have no details about when that may actually occur. So even though, there's conversation about other providers having the ability to become a vaccine clinic, that could be a ways down the road. So we're just really, really encouraging all staff, as we're in these second clinics that started this week. If you haven't gotten your first dose, please give strong consideration, because we don't know how long it may be before you can get a first dose after this clinic. So.
I know we touched on this a couple of times in our questioning, but we did have a specific Q&A question on it. Has there been information on symptoms after receiving the second dose of the vaccine? And there's something you can do beforehand to prevent such symptoms. And we're talking specifically about the Pfizer vaccine with this question.
So, we talked about it as far as the side effects go. There's nothing you can do to prevent side effects. You can take some Tylenol after the vaccine. That will help with some of the pain or the discomfort. On one of the Ohio panel calls, I guess there was some information about you should take Benadryl before you take the vaccine. That is not recommended. So that taking a Benadryl before the vaccine is not recommended. Taking Tylenol after the vaccine is certainly acceptable practice.
and I, in regards to taking the Benadryl before the vaccine, it's not recommended because they do not want you to mask any potential side effects that you may have. That's the reason behind not taking the Benadryl prior to getting the vaccination.
We have a staff question from the Laurels of Worthington. If you take the COVID-19 vaccine, we still have to participate in mandatory COVID testing at the facility.
Yes, you do. So as Jane has explained, taking the vaccine, you are not getting a live or an inactivated version of the COVID virus. So you will still have to participate in the mandatory testing.
So as we are hoping that we get the herd immunity, if we can get 80%, I mean, not necessarily just us as a company, but if we can reach that threshold of 75 to 80% herd immunity, we're hoping that our government leaders will look at the decreasing need to test as often. But this is, getting the vaccine is really the only way to get back to normalcy.
And then our final question from the Q&A, how did Moderna and Pfizer determine the efficacy of the two vaccines?
Okay, I'm happy to take a stab at this. Statistically speaking, whenever they start the clinical trials, they try to get a group of people that's diverse in that it somewhat mirrors the population. Some of them will get the vaccine, some of them will get a placebo, and then they test them, I'm sure, just like we get tested, to see which ones become positive and which ones don't. I'm sure it was a blind study. They don't know if they got the vaccine or the placebo, but then they compare the two groups to see did the placebo group stay well like the vaccinated group did, or did the vaccinated group get sick at the same rate that the well group did? And so I can only guess. I was not part of the clinical trials and I'm not a scientist, but that about 95% of those who got vaccinated did not get sick. I have no idea what the placebo group did, but it must have not been 95%, or they would not have been able to publish the results to the FDA. So That's just how research works, that little piece of it. So if anyone else wants to take a different stab at it, you are more than welcome.
I also, and I don't remember if it was the ODH call I was on or if it was the CDC call that I was on. One of the panelists was in the trial and had made a comment that after she started to experience some mild side effects, then she actually knew that she was getting the vaccine and that she didn't get the placebo, because that was her, as Chris explained earlier, that's your body's response to getting the vaccine, is that you may have these mild side effects because your body is starting to produce some protection against the virus.
That's a good point, Trista. And I did notice one more question that came to the general Zoom chat. What happens if there isn't a second part of the vaccine available?
So I guess we can all kind of take a stab at this one if you'd like. We've heard that, we've heard things about the government saying, let's just stick with the first vaccine if we're running out. I mean, I've heard so many different stories on that. Right now, we do know that we have our second and third vaccine clinics scheduled. I have not been notified, and I'm in constant contact with the pharmacy that we deal with. I have not been notified that we're expecting a shortage for the second dosing. Right now we're in our second clinics in a lot of our facilities. So I don't expect that to be an issue.
I would just jump in and add that our facility staff and residents were in the first phase for good reason. And I don't think that anything is going to change that reason, that we have the most vulnerable population that we care for, and we have frontline staff. So it would surprise me if our vaccine availability was affected by a decision to only do one dose. But that said, I think this is our opportunity to do it. I wouldn't want to bank on us like having multitude of vaccines available in the future, because they kind of gave us this first shot at it, no pun intended. So I think our time is now to be sure that we get an opportunity with it. And I think the other sort of worst case scenario is, we know that after a first dose, there is some effectiveness. What you hear Moderna and Pfizer say and what they share in their research is the ultimate effectiveness of 94.1 or 95% comes from having that second dose spaced at a certain interval. So to get the most ultimate protection to either prevent COVID or to minimize the effects of COVID if you get it after you need those two doses. But we do know that there is some immunity after dose one. So like in the big picture, that's what I'm kind of resting on. If they decide that for the rest of the world, we do know that there is going to be some effectiveness, even if they just went with one dose.
And again, Ryan, I think just stressing the fact that, like Kathy said, we're in phase 1A. We're the first tier to get the vaccine. So taking that opportunity, as we know we have it right now, I think is, if you have any interest at all in getting the vaccine, you really need to jump on the opportunity to take it, because we know that we have these clinics scheduled and we know that we can get you the vaccine, and we're fully expecting the second clinics to complete that dosing. And there has been chatter about people waiting to see after the first clinics, how people respond to it and if there's any issues and things like that. So please, if you're even considering getting the vaccination, make sure you sign up with your facility so that you have that opportunity and you seize it.
So it looks like we don't have any more questions. So with that, we'll conclude this expert panel. We want to thank our experts for their feedback. If you have any further questions, please take advantage of the Ask About COVID-19 email, askaboutcovid19@laurelhealth.com. facility administrators, DONs, you can use that as well as your frontline staff. If frontline staff have questions, please have them submit the questions through that email and we'd be happy to answer them. We have another call this evening at 7 p.m. We're trying to get a one call now notification set up to get out the word to more people. Jane has sent flyers. Please, with call-in information, please make sure that those are widely distributed. And as I also mentioned at the beginning of this call, we will have a recording of either this panel or the 7 p.m. panel uploaded to LaurelNet at some point. So thank you all for joining us today, and make sure you get vaccinated. Have a good afternoon.